This is Late Night Health. This is the radio show that cares about the most important part of your life, your health. Hi, I'm Mark Alyn, and along with the insane Daryl Wayne, we're going to spend the next 2 hours talking about a number of health topics that touch each and every one of us, from breast cancer and the latest research. We'll be talking to a survivor, a breast cancer survivor coming up. We'll be talking about the FDA and does it need to exist now. We'll be talking about relationships. We are recording on Valentine's Day, and we're going to be talking about working with a spouse, and we'll have some comments also from our regular contributor, Robert Clancy, on true love. We'll also be spending some time talking about a research project for Parkinson's disease as we wrap up today's edition. We go now to not Washington, D.C., but Phoenix, Arizona, and we speak to our friend, Karen Howard, the CEO and Executive Director of the Organic and Natural Health Association. Karen, welcome back to Late Night Health. It's been too long.
Thank you, Mark. I love being on with you.
Thank you very much. Hey, listen, let's give a brief overview. What is the Organic and Natural Health Association? What's it all about?
Well, we are a trade association, so technically we're a 501c6 for those people who follow that. But the unique thing about what we do is we represent industry, so we represent the supplement and moving in towards food. And along with that, we represent retailers and consumer organizations, all for the spirit of creating a sustainable future by rebuilding that relationship and trust between consumers and their customers. So we actually represent the entire supply chain.
So from consumers to the guy who invents a new supplement.
Yeah, from the raw ingredient suppliers all the way to the end user for supplements. Moving into some of the biodynamic areas with things like American Grass-Fed Association's new beef and dairy standards.
Ooh, cool. We'll have to talk about that, too. Our topic today is the FDA, the Federal Drug Administration. The FDA's mandate is to protect the American people. Am I correct in that assumption?
You are correct.
Yet, over the last 5 years of doing this show, and say another 25 to 30 talking about natural health in other programs and other venues, I'm a little bit concerned that maybe the FDA does not really take the American people themselves as individuals, as consumers, in mind when they protect us, and figure that they may be protecting Big Pharma instead. Can you comment on that?
Most of these organizations take their direction from their bosses. They have two. One would be the President of the United States. The other one would be Congress. So what you see over time is a reflection of policies and funding measures that have really driven the agency to behave in particular ways. And that could be just as simple as who they put in at the top, all the way down to what we're dealing with now with the Trump administration's desire to end federal regulation, which is a bit of a a double-edged sword. In that one, we all, from the supplement side of the world, we think that, we get it from both ends. We hear constantly, I just talked to 2 people from the Department of Agriculture who left from the Obama administration, again hearing that dietary supplements are not regulated. So we have that burden, and then we have the agencies attempt to impose additional regulatory burden that doesn't make any sense. And now we have a president who says, we don't need regulation at the FDA. We should just put pharmaceutical drugs on the market when the corporation says they're ready. So it's very confusing and very hard to sift through.
Does the Trump administration say the same thing about supplementation? They
haven't said anything yet. So our first indication will be who they decide to put in at the head of the FDA, and those parties that are kind of rumored to be, the contenders, there are 2 or 3 of them, are really not very well versed in our topics at all. Tend to range, just like many of the president's other appointments, with varying degrees of skills that may not have any bearing on this particular agency. So that's one issue that we have to watch, and then we'll have an opportunity as trade associations in Washington, D.C. to get to our members of Congress and submit questions that'll tell us if they've ever taken a supplement or think about them at all.
Which would be an indication of maybe they like them or they don't like them.
You just never know what people's experiences are. And while we know that the majority of the population does take dietary supplements on a regular basis, we can't count on that. It's starting to have an impact, certainly in the general public, which is moving this conversation much faster than government ever can, with heads of organizations and presidents. Look at President Trump's background. He had a multi-level marketing company in the industry. I'm not sure he ever knew that.
But he owned it.
Right.
And they were selling a variety of supplements. What's the percentage of Americans who take? I know it's over half who take supplements regularly.
It is over half, and understand that the preponderance of those people are generally taking a multi every day. The people that you and I run around with, Mark, we're all taking single ingredient products and complicated omegas. We tend to be well schooled on these things, but the general population is by far, they're very well versed in the whole multivitamin piece of it. And as people age, get more experience with taking additional supplements. Not to mention the change that we've seen over all these years with things like vitamin D, where all practitioners are now measuring vitamin D levels. So it's improving on a regular basis.
Absolutely. And we have in this country, my understanding is a epidemic of low levels of vitamin D. One, because we've been scared to stay out in the sun. And two, people just don't eat enough broccoli, for example, which is rich in vitamin D, but you can't eat enough to absorb what you need.
You cannot eat enough of anything to get your vitamin D levels. And to get it from the sun, you've got to be out in real sunlight 20 minutes every day with shirt sleeves on. So it's become almost impossible. It is epidemic. And the consequences are enormous. Our project that we've been working on for the past year with promoting vitamin D testing, the Grassroots Health, our partner in that, after a 2-year study, has confirmed what we already knew from a clinical trial, that establishing solid levels of vitamin D, which is 40 to 60 nanograms per milliliter, will reduce preterm births by 50%. Yet, the March of Dimes refuses to talk to us about it. So,
oh my.
Yes. It's like travesty in terms of some of these nutrient deficiencies. And that's really one of the things we're so committed to, is continuing this nutrient field research so that we can get all the nutrients where people are deficient studied and start to prove that case.
I know that vitamin D has so many different aspects. It's considered a hormone by alternative health practitioners. And as you said, MDs, traditional medical doctors, are testing for it now. And in fact, I just had a blood test within the last 3 or 4 months, and I am on a supplement now for vitamin D.
I take a regular dose of 2,000 IUs a day, which raised mine in a course of 6 months from high 30, like 38, all the way to almost 60. So that's where you want to be. And now we're moving in this year. We're kicking off. I think April will be our official start. Our new omega-3 testing, which is promoting knowing what your DHA levels are, and no one's testing for those right now. So we're hoping to have the same success with omegas that we have had with vitamin D.
Does the FDA have any overview in this area at all? I mean, we've talked about, you and I have talked about it. We know that there are rules and regulations by the FDA for the manufacture, the manufacture and distribution of supplements, and for the most part, I think they're good regs.
I think they are good regs. I mean, and they have, they have procedures, and everybody adheres to some, research procedures and clinical trial standards. Those are all good things. But I'll tell you, I just looked at a supplement label yesterday that on a vitamin D3, it said, do not take if you are pregnant or lactating. Now, I just told you that by taking vitamin D, you can reduce preterm births by 50%.
Right.
So the FDA's position on what kinds of claims we can assert are so limited. We should be on par with OTC. The data is out there. So I'm personally hopeful that under this Trump administration, even with an unknown FDA, maybe some of those things, maybe this is the time where we can start to talk some reason about what is a good solution to some of these issues, and how can we make changes that are meaningful and helpful to consumers? Because that's the perfect example. Don't take vitamin D when you're pregnant? That's crazy.
It doesn't make sense to me either. Our guest is the CEO and Executive Director of the Organic and Natural Health Association, based in Washington, D.C., Karen Howard. She's a frequent visitor to us here at Late Night Health, and we're going to take a timeout. And when we come back, we will continue talking about the FDA and consumers as it relates to vitamin supplementation. Don't go away. Late Night Health continues. More at latenighthealth.com.
You're listening to Late Night Health with Mark Alyn. The show continues in a moment.
If you or someone you love suffers from drug addiction, now is the time to utilize your private health insurance PPO plan. If eligible, receive up to $30,000 or more in substance abuse benefits with low or no out-of-pocket cost. We are the National Treatment Network, the premier drug and alcohol treatment referral service operating 24/7. We help connect you with facilities nationwide that accepts PPO private health insurance for substance abuse. If you have PPO substance abuse coverage and you need immediate admittance to a medical detox or residential rehab treatment center, call us now. Call our live referral helpline today. The call is free. This program is not available to Medicare or Medicaid customers.
Call 800-296-1252. 800-296-1252. 800-296-1252. That's 800-296-1252.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate a lower tax bill. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will fight for you using industry secrets that can stop any IRS actions, eliminate penalties and interest, and reduce your past tax bill so you pay the IRS less. If you owe $10,000 or more in back taxes, call the Tax Doctor now for a free IRS audit emergency review.
800-663-5107. 800-663-5107. 800-663-5107. That's 800-663-5107.